Welcome to the Psychology and Physical Training channel, Introduction to Counseling for Children with Behavior Problems. Ever wondered why children act out or misbehave unpredictably? Is it just a phase or a sign of a deeper problem? Welcome to our deep dive into the complex world of children's behavioral problems. These are not merely tantrums or bouts of moodiness, but substantial challenges that can have profound impacts on a child's life. They can manifest in various forms, each with its unique characteristics and implications. One such category is childhood behavioral disorders, where children might display consistent patterns of disruptive behavior, defying rules, and showing aggression. Another common type is childhood anxiety disorders, where children often exhibit excessive fear, nervousness, or shyness. Let's not forget about attention deficit hyperactivity disorder, or ADHD, a condition that affects a child's ability to focus, sit still, or exercise control over impulses. All these are not just labels, but windows to understanding what our children might be going through. Understanding these disorders is the first step towards helping children navigate through them. Causes of behavioral disorders. So what causes these behavioral problems in children? That's a question that many people have asked, and as it turns out, the answer is not a simple one. Behavioral disorders in children can stem from a myriad of factors, each contributing in its own unique way. Let's start with genetics. Just like eye color and height, behavioral traits can also be inherited. Studies have shown that children who have a family history of behavioral disorders are more likely to develop them. However, it's important to remember that genetics is just one piece of the puzzle. It creates a predisposition, not a predetermined outcome. Next, let's talk about brain structure and functioning. Sometimes, differences in the way a child's brain works can contribute to behavioral problems. For instance, children with ADHD often have differences in the part of their brain that controls attention. Environmental factors also play a significant role. These factors can include everything from exposure to toxins in the womb, such as alcohol or drugs, to experiencing traumatic events or chronic stress in childhood. Even factors like poor nutrition or lack of physical activity can influence a child's behavior. Furthermore, the influence of family and social environment cannot be underestimated. Children learn a great deal from their surroundings. If they're constantly exposed to conflict, aggression, or neglect, they may start to exhibit these behaviors themselves. And then there's the role of psychological factors. Children who struggle with low self-esteem, anxiety, or depression are more likely to exhibit behavioral problems. These psychological issues can stem from a variety of sources, including experiences of bullying or rejection. It's clear that the causes of behavioral disorders in children are complex and multifaceted. They are often the result of a combination of factors rather than a single cause. This underscores the importance of comprehensive assessments and individualized treatment plans when dealing with these disorders. While these causes can be complex and multifaceted, they can provide valuable insights into the child's behavior. Understanding the root causes can pave the way for effective interventions and ultimately, a better future for our children. Behavior. Leading to psychological disorders. Can these behavioral issues lead to more serious psychological disorders? This question may loom in the minds of many, especially those who care for children exhibiting behavioral problems. The answer, unfortunately, is yes. Untreated behavioral problems can potentially escalate into psychological disorders later in life. Take autism, for instance. It's a neurodevelopmental disorder that can be identified early on, typically within the first 3 years of life. Children with autism often have trouble with social interaction and communication. They may exhibit repetitive behaviors and show limited interest in activities or play. While autism is not caused by behavioral issues, certain behaviors associated with this condition, if left unaddressed, can exacerbate the psychological challenges these children face. Next, let's consider hyperactivity. It's a hallmark of attention deficit hyperactivity disorder, also known as ADHD. Children with ADHD often struggle with impulsivity, inattention, and hyperactivity. These behaviors, if not managed effectively, can lead to a host of psychological issues down the line. They might face difficulties in social situations, have low self-esteem, and struggle with anxiety or depression. It's important to note that not all children displaying these behaviors will develop psychological disorders. However, the risk increases when these behaviors persist without intervention. Stress, Family dynamics and other environmental factors also play a crucial role in this progression. So what's the takeaway here? It's all about early identification and intervention. Recognizing these behavioral issues and addressing them promptly can prevent them from escalating into more serious disorders. It's not about labeling a child, but rather understanding their unique needs and providing them the support they need to thrive. We need to remember that every child is unique and their experiences shape their behavior. So let's strive to understand these behaviors rather than merely reacting to them. With patience, empathy, and professional help when needed, we can guide these children towards a healthier psychological state. Early identification and intervention can help prevent these behavioral problems from escalating into more serious disorders. Because at the end of the day, our goal is to help these children live fulfilling, happy lives, and early intervention is a crucial step towards achieving that. Understanding child's reactions. How can we understand a child's aggressive, overanxious, or withdrawn reactions? It's a question that many of us grapple with, whether we're parents, educators, or psychology students. Let's begin with aggressive reactions. Children who often display aggression, such as by hitting, yelling, or defying authority, may be dealing with underlying behavioral disorders. This aggression often stems from frustration, fear, or a lack of coping mechanisms. It's not simply about bad behavior. It's a cry for help, or a sign that the child is struggling to express their emotions in a healthier way. Now let's move on to overanxious reactions. Overanxious children may exhibit excessive worry, restlessness, or an inability to relax. They may constantly seek reassurance or struggle with perfectionism, fearing that they'll make a mistake or fail. These children are often dealing with anxiety disorders, which can severely impact their daily lives and overall well-being. Lastly, let's discuss withdrawal reactions. Children who often withdraw, isolate themselves, or show little interest in social interactions may be dealing with depression or other mood disorders. This is not merely a phase or a sign of introversion. It's a serious issue that requires understanding and intervention. It's important to note that these reactions are not definitive diagnoses. They're indications, signals that should prompt us to seek professional help for the child. A child psychologist or psychiatrist can provide an accurate diagnosis and suggest appropriate treatment options. By understanding these reactions, we can start to see the world from the child's point of view. We can begin to empathize with their struggles, validate their feelings, and provide the support they need. We can also learn to respond rather than react, which can help de-escalate situations and foster a safer, more supportive environment for the child. Remember, children are not problematic. They have problems that they need help with. And it's our responsibility to provide that help, to guide them towards healthier ways of expressing their emotions and dealing with their challenges. Recognizing these reactions can help us better understand and support children with behavioral problems. So let's keep learning, keep understanding, and most importantly, keep supporting our children. Counseling strategies for children with behavioral problems. So, how can we help children with behavioral problems? Well, the first step is understanding that each child is unique and there's no one-size-fits-all solution. The key is to tailor our approach to the child's specific needs and circumstances. One of the most effective counseling strategies is cognitive behavioral therapy, or CBT. This evidence-based approach helps children understand the connection between their thoughts, feelings, and behaviors. It offers practical strategies to cope with challenging situations, teaching children to challenge irrational thoughts and develop healthier responses. But remember, it's not just about the child. The family environment plays a significant role in a child's behavior. That's why family therapy can be a powerful tool. By involving the whole family, we can address broader issues and dynamics that might be contributing to the child's behavioral problems. This holistic approach can lead to lasting changes, not just for the child, but for the entire family. Another effective strategy is psychoeducation, which involves teaching the child and their family about the nature and management of their behavioral issues. Knowledge is power, and understanding the why behind their actions can be a game changer. In addition, promoting self-esteem and resilience is vital. Children with behavioral problems often struggle with low self-esteem. By helping them recognize their strengths and develop coping skills, we can bolster their resilience and empower them to overcome their challenges. Remember, patience and consistency are key. progress might be slow, but every small step is a victory. Lastly, it's essential to collaborate with schools and other community resources. They can provide additional support and reinforce the strategies used in counseling. In conclusion, it's about understanding, patience, and a holistic approach. It's about not just managing symptoms, but empowering the child to navigate their world. With the right support and strategies, children with behavioral problems can overcome their challenges and thrive. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thanks for watching.